Hi all. Today let's learn a small topic on ophthalmology, keratitis. Before moving on to the topic, let's have a brief introduction on the anatomy of eye, especially regarding cornea, because the keratitis is an infection which affects the cornea. Cornea is a thin transparent layer which is seen in the anterior chamber of the eye. Here on the slide, you could see a human eye which looks so beautiful. It's a healthy eye with a healthy cornea. The cornea gives the brightness and the glazing to our eyes. Inflammation of cornea may lead to permanent visual impairment. Next, let's see the definition of keratitis. Inflammation of cornea characterized by corneal edema, infiltration of inflammatory cells, and ciliary congestion is called keratitis. It can be usually associated with infectious or non-infectious causes. Now let's see the types of keratitis. Keratitis can be classified into many categories based on different factors. And first one is based on the causative agent. Based on the causative agent, keratitis is classified into three: bacterial keratitis, fungal keratitis, and viral keratitis. Bacterial keratitis is mainly caused by Staphylococcus aureus, Pseudomonas aeruginosa, and the fungal keratitis is caused by Aspergillus. Viral keratitis is mainly caused by two types of virus, herpes zoster and herpes simplex. The keratitis which is caused by herpes simplex virus is mainly known as dendritic keratitis. Based on the layers involved, keratitis can be classified into superficial and deep. In the case of deep keratitis, deep scars may occur on the cornea, which may cause visual impairment either partially or completely. Then the final classification is based on other factors. Based on other factors, keratitis can be two types: exposure keratitis and photokeratitis. Exposure keratitis can be due to inadequate eyelid closure. You could see here an image of a person with exophthalmos eyes. From the figure itself, we could see that the eyelid is protruded very much towards the external environment. It causes the drying of cornea, and the eyelids are small, so in these people, so that the eyelid cannot cover the entire eye. This causes drying of cornea, and further these people can get affected with keratitis. And the exposure keratitis can also be caused in patients who are in coma and is on ventilator. Sometimes they may keep their eyes open even though they are unconscious. So in such cases, in hospital settings, we would use some lubricant eye drops in order to prevent the drying of cornea and prevent the chances of keratitis. Then the next one is photokeratitis. Photokeratitis is due to exposure to UV radiation. We all know that the UV radiation are stronger enough to cause damage to our cells, and it could cause damage to cornea on direct exposure. Next, let's see some causes and risk factors of keratitis. First one is foreign body. It is common among many people, especially among children. Whenever some foreign body got trapped in our eye, we mostly get a tendency to rub it against our cornea, and this may cause eye injury and further may lead to keratitis if not treated properly. Next one is contact lens usage. Nowadays, contact lens has become a commonest material used by many people, irrespective of their age. And improper usage of this contact lens can lead to keratitis. Next, autoimmune diseases. Here I have mentioned an autoimmune disease which could cause keratitis, that is Sjogren's syndrome. Some use of medications uh, on a daily basis can also cause keratitis. It can be some OTCs or some antibiotics that some people may have a tendency to take these drugs by themselves without the prescription of any doctor. Next is due to geographic reasons. Some people would have an irritation to their eyes on getting exposed to a dry climatic condition, and this can also be a factor that cause keratitis. Next, let's see the signs and symptoms of keratitis. First one is pain. Next, redness. It may also cause blurred vision and can make our eyes highly sensitive to light. And the single term which is used for the sensitivity is called photosensitivity. Cloudy appearance may happen to the cornea. Here you could see many images which shows the eyes affected with keratitis. And on the top left corner you could see a healthy eye which is clear and visible. Then excessive tearing can occur during keratitis. It means the lacrimal gland will get overactive and our eyes will be watery at all times. Next, let's see the medical management of keratitis. As the keratitis can be caused by either virus, fungus, or bacteria. Several drugs like antivirals, antifungals, and antimicrobials are used depending upon the causative agent of keratitis. If it is caused by a virus, acyclovir used topically can be beneficial. If it is caused by fungus, ointments of netamycin can be beneficial. If it's caused by any bacteria, several antimicrobials can be suggested. Some antimicrobials which is commonly used in keratitis includes the group of fluoroquinolones, moxiflox, otherwise called as moxifloxacin, oflox or ofloxacin, and ciprofloxacin. It's one of the commonest drug which is used in many of the eye infections, including keratitis. And other fortified antibiotics include vancomycin, tobramycin, or cefazolin. To relieve the symptoms of keratitis, other medicines like analgesics and corticosteroids are also prescribed by the clinical practitioners. Analgesics can be diclofenac or ketorolac. Then the ultimate management of keratitis, in case if it has caused severe impairment, we could move on to surgical management. It can be keratoplasty, otherwise called corneal transplantation. In this surgery, the damaged cornea is removed and a new cornea is transplanted in the place of the old one. Here in the slide, you could see the step-by-step procedure of corneal transplantation. Here is an original image that shows the corneal transplantation steps. This could help you to relate it with a real life scenario. As we always say that prevention is better than cure, let's see how we could prevent keratitis from happening. Handle contact lens with extreme hygiene. As I have already mentioned that the contact lens usage can lead to keratitis. If we have used this contact lens without proper hand hygiene, or if we have shared the contact lens with some other people, it may increase the chance of us to getting affected with this keratitis. Avoid sharing of infected articles. Even the eye makeup or any kind of such articles that we are using or sharing with other people can cause keratitis. Eye protection during UV exposure. In case of UV exposure, or in case of people who are working in certain factories who get exposed to UV radiation, may use specialized goggles for their eye protection. Also, some systemic conditions like diabetes can cause keratitis in very rare cases. So, proper control over diabetes and other systemic illness is essential. Now, let's see some nursing diagnosis which we could write down for keratitis. Acute pain related to irritation or infection of eye. Next one is anxiety related to outcome of treatment. Next, disturbed sensory perception related to diminished vision. Next one is knowledge deficit. As nurses, it's our responsibility to take care of our patients. So, educate each and every people regarding the importance of maintaining eye hygiene. Thank you. I hope you all understood today's topic. Have a nice day.